It's your favorite nurse, Stephanie, and welcome to Plan Senior Moment. This is the podcast that helps you learn how to keep your parents safe, avoid unnecessary hospitalizations, and support them in aging in place with dignity and confidence. Most of my clients come to me during a time of crisis. Mom's in the hospital, things have changed drastically, and suddenly you're scrambling to come up with a plan of care. But it doesn't have to be that way. With each episode, I'll share real-life stories, expert advice, and practical tips so that you can be proactive, not reactive when it comes to senior care. Let's get started. Hello, and thank you for joining us today. Today we have Angela Garrett, Director of Operations, and Tiffany Smith, Spa Manager and Medical Lead with Prime IV Hydration and Wellness and Any Lab Tests Now. That was a mouthful, but I got it out. Thank you both so much for joining us today. Let's start with you, Angela. Tell us a little bit more about, because you guys are going to split this up and tell us about your services. So we'll just start with you, Angela. Tell us more.
Any Lab Tests Now is a franchise, and we opened in 2008. And we're here to serve the community for self-pay customers or customers that want to be in and out and do cash pay for services. One area that we really stand out for is our TB skin testing. Very affordable. It's a one-time fee of $59. And you can do a walk-in for that. If you have a difficult time getting into your vehicle, we can come out to your vehicle, place that for you, and then you come back to have it read 48 to 72 hours after. We set it, and then you get the results right then and there. A lot of people have a hard time finding where to get a TB skin test without having to go to their doctor. With Any Lab Tests Now, you can completely skip that wait time of getting in with your physician and schedule an appointment same day, next day, or do a walk-in. We also offer any type of lab testing that you would need with or without a doctor order. So we see a lot of TINR testing done, especially people that are visiting here in Arizona. Also, a lot of thyroid testing we do as well.
This is wonderful. And I'm going to break this up a little bit because, what I run across a lot with my clients, and even in the past with hospice as a nurse, is that when it came time to when care needed to be at a higher level, right? It could no longer be managed in the home, whether it was due to finances or for whatever reason, then we start looking for a community like an assisted living facility or a group home. And one of the requirements is that they have to have a two-step TB skin test, and both need to be negative. And there's some pretty strict requirements in there, right? You have to wait like at least 7 days in between the first one. And after you have it, 48 to 72 hours, it has to be read. And sometimes that's really challenging for families to figure out where to go and how to get those appointments. So I love that you guys do that because there's such a huge need. And then also you touched on the other labs with the PTINR and thyroid lab blood work. We do have a lot of people that are here part of the year or half of the year, and they're looking for these solutions. So that is wonderful. And you said it can be private pay or insurance. Is that correct?
No, we do not accept insurance. So it would be
It's private
pay.
Okay, very good.
Yes.
All right, thank you.
Most of our results take 1 to 3 days to get back. We can also run stat labs, which will happen about 8 hours.
Oh, that's great. And then do you guys give that to the family, or can you send that information directly to the community or their physician? How does that work?
So we can release results to wherever the patient would want us to release results to. We can email it to their family, to them. If they have their doctor's information, we're more than happy to call them, get their fax information, and release the results to them as well. So whatever the patient requests, we can do for releasing results.
Wonderful. And walk-in too, you said, right? That's
Yes.
That's a possibility. Okay. Wow. That's incredible. And
Yes.
where are you guys located around
when-
the community?
And when people usually walk in, there may be a 15 to 20-minute wait. So it's very short. We do encourage to schedule an appointment. That way you're in and out within 15 minutes. And we are located on Via Linda and 90th Street in Scottsdale.
Wonderful. Thank you. This is great. And then
Yeah.
Tiffany, tell us more about Prime IV hydration. Tell us all about it. Do they need to walk in, or can you go to them? Tell us everything.
Yeah, we do focus on bringing people into our spa. I've been doing this for over 13 years. I love it. It's a passion of mine. We do mobiles also, but when you come into spa, we have oxygen therapy, full body massage chairs. We really tailor IVs to you and the needs that our customers need. We can customize IVs. We have full menu to choose from. We do a full medical consult for your first time or anytime you ask if something's changed with your medical history. We have a doctor that oversees us. He checks all my charts and everything. But so yeah, we want people to come to us just because of our full body massage chairs and oxygen. It's definitely a added bonus for most people. They really enjoy that. It's a spa setting, very quiet. We focus on your 1 hour vacation from the time you walk through that door. We want you to be pampered from the time you leave.
That is wonderful. And then tell us more about the solutions that can be provided: hydration, vitamins.
Yeah, we have 2 different solutions we can use. One has some electrolytes in it, and one is just normal saline like you would get in the hospital. And then depending on kind of what they want out of their IV that day, we can customize an IV for them and put vitamins, different nutrients, depending on what they want. I have customers that are trying to fix their blood pressure. They're trying to get off medication, so I can tailor things for them to help them with their medication stuff.
Wow, that's incredible. I have not heard of that either. And
Yeah,
do you guys have a mobile solution as well? If there's a group, like I'm in and out of a lot of the communities, like assisted living, independent, and oftentimes companies can coordinate something if there's enough people that want to participate.
Oh, yeah, we can come to you. Depending how many people there are, I can bring 2 to 3 different medics to come out with me so we can get you done fairly quickly. About 5 people I'll do myself, but we do a ton of different events. We go around Scottsdale, do a lot of Airbnbs. People come here for things. A lot of the golfers, the elder population, they love to golf, so we can do golf events. Stuff like that to get people done at once if that's what they prefer.
Oh, that's wonderful. I totally off subject, but I was hiking Camelback yesterday morning and I came across a woman who was not doing well. She was very sick, throwing up, and people come here and they don't realize the seriousness of our weather, how hot it is and dry
How
it is.
hot it is. We get that a lot here. People are like, I'm visiting for a golf event, and I tried to drink water and I just couldn't. But not only hydration, but getting the good quality vitamins into your system can help cognitive function. It can help lower your blood pressure. It can help you sleep at night. With our elder population too, they are prone to dehydration because as we age, our thirst is decreased. We don't have that sensation anymore, or medications or kidney function. So it's hard to keep them hydrated. So this goes straight to the system, bypasses the GI. They don't have to worry about chugging a bunch of water. One of our liters is equivalent to 2.5 gallons of water being drank. So pretty hydrating.
Wow. And you're right. Urinary tract infections, dehydration, malnutrition, a lot of these fall, unfortunately, into our senior population who are in assisted living or memory care or a group home. And something that sounds so simple, hydration, right? It's not so simple in this population. And also,
Yeah, I noticed my grandma, she hated to drink water.
yeah. I mean, I almost think
She's
this would be something that
drinking
everyone,
tea all day.
we're just dehydrating her. I just think all of our assisted livings and communities should be recommending this to their clients for the hydration, for helping with blood pressure medications, getting those extra vitamins in their system. It's just such an incredible resource that I think is so overlooked in all age groups, truthfully. Locations. If you said something about the locations for Prime IV, please excuse me, but I can't recall.
We are on Via Linden 90th, right next to the lab in Scottsdale.
Okay, so same location.
Yep, we're
Okay.
right next door in the complex.
Wonderful.
And also something that we are doing, Stephanie, with Prime IV Hydration and Wellness is we are running a big campaign right now for senior centers. So I have been meeting with senior center director and event coordinators on how we can help better assist in hydrating their residents and spreading awareness on why it is so important. So with a lot of these communities, we're getting good traction. Hopefully they'll implement something into their activities or their health and wellness programs to where we can come in once or twice a month to hydrate that are experiencing lightheadedness, dizziness, just dehydration in general. Some of these facilities, they have doctors on site, which is great because they can recommend that they need fluid and then hopefully sign up on the day that we are going to be there and then receive the IV infusion.
That's wonderful.
It's something that we just rolled out this year and we have been hitting hard on for education. because that's a big part of it. Because when people hear IVs, they're thinking, oh, hangover, but we're thinking preventative.
Health and wellness.
Yes, health and wellness, reduce the risk of falls, enhance overall wellness and energy levels, better hydration, better nutrient absorption. So that's
So
what we're
many
looking to do,
benefits.
is spread education about it and the amazing benefits.
Yeah, and you brought up a good point too. So the physician is involved, right? So the physician is going to have that oversight. They're going to know it's safe, that they can handle the hydration, right? That it's going to stay where it's supposed to be and not seep out into other areas of the body. Is that something that your physician there coordinates, or do they coordinate with the physician of the elderly patient as well?
So for the facilities that we are going into, if they have a doctor on site and they recommend that resident would benefit from IV therapy, we would have them fill out one of our health intake forms. And then if there's any contraindications, that would be approved through our medical director.
Okay, wonderful. So
But-
lots of oversight.
Yes. Yes, we want to make sure that, like I said, there's no contraindications, and
Safety is our number one priority here. So
yes.
we make sure to follow things very cautiously, very safe for our customers.
This is wonderful. You guys, I just love what you're doing. I love that you're putting together some mobile solutions when it's right, because it is it's tough for our senior population at times to get around. Driving may be an issue, or some of their medical conditions. So I really applaud you for putting together some mobile solutions for our senior population. I just absolutely love what you're doing, because we can keep them feeling better. We can prevent unnecessary hospitalizations and all the issues associated with just something as simple as dehydration.
Yes.
Yeah, I have a lady that comes to me now because she used to go to the hospital once a month just to get an IV. And she's paying her copay. By the time she's done, it's pretty expensive. She found us and she's just in heaven. She just loves it now that she just comes here. Bypasses all that, doesn't get sick from the hospital.
Yes. Something like a fall, my goodness, it can change your life completely. It could result in a surgery. It could result in a head laceration. And these things can change your future in a major way. So just something so simple and inexpensive, really, when you look at the long picture. Thank you both, Angela and Tiffany, so much. For our audience that's listening, what's the best way for them to contact you?
They can call us by phone. Any lab test now, its phone number is 480-451-0002.
And at Prime, you can call us at 480-565-4040. We do take appointments and walk-ins. Also, we try and get you taken care of in a timely manner. If you are a walk-in or appointment, we want you in and on about an hour by the time you get done dripping and everything.
Yeah. Wonderful. Thank you again so much for taking time to discuss your services with our audience.
Thank you for having us.
Yes, thank you.
You bet. Thank you.